Good morning, everyone, and thank you again for joining in the conversation about the transformation of mental health and focusing on that being a process that we get to go through the lens of social work and where social workers are deep into the conversation about the transformation of mental health and what that looks like. We have been talking in a think tank, in other groups and meetings that we have that are all focused and centered around this experience of and wish for a system that is inclusive and creates the kind of experience of receiving services as being one that is positive and well-informed. So, and what we've been doing in these conversations has been using some of the writings that we have done to add to the conversation. We have been looking at, in particular, recently, we have been looking at this article here about unveiling the strengths of social workers. And so the part of this that I'm going to be addressing today is about versatility and adaptability, which is right here. And it says, from counseling individuals and families to shaping policies and driving community initiatives, social workers showcase remarkable versatility. They navigate a range of roles, from providing emotional support to crisis intervention, from facilitating group sessions to leading community development projects. This adaptability enables them to respond effectively to the ever-evolving societal needs. So one of the reasons why this comes up for me today in this conversation is because we recently, some of our discussions have been about what is holding us as social workers back in these conversations. What is coming up for us, and the possibility that some of what is coming up for us is, or for any mental health provider, is a fear, perhaps, of what our role will be in a transformed system. And so some of that, and we had some of this conversation in our most recent think tank, is that some of that is the belief that in transforming the mental health system, we would be completely freeing everyone of whatever their ailments might be, whatever their concerns or their issues or their needs might be around mental health. And that's just not the case. We know that for as long as, as we will be walking this planet, there will be a human condition that we will also be navigating. Fears, concerns, worries, diagnoses, whether they are mental health or they are substance use, or they are developmental disabilities, or intellectual disabilities, or physical issues, or anything, grief, trauma. Those things will still we will still have experiences of those events in our lives, and we will still need support from people to be able to do that. This transformed system is not about the belief that all that ails us is going to somehow disappear. It is a measure by which each and every one of us gets the same level of access to care that we need in order to live the most fulfilled life possible. So I'd love to hear your thoughts about this. Please put your comments in the chat box, and we look forward to meeting again and continuing the conversation.